My name is Jane Yip. I am a clinician and I have provided services for children, mostly children and adult on the autism spectrum for over 10 years. In addition, I am also an autism researcher for 20 years. I've had a lot of experience one-to-one and countless hours of clinical therapy experience with the group that has symptoms of autism. As a result, I feel like it will greatly help the field to provide an app for people who struggles with the symptoms of autism. And the app has a purpose of allowing us all to be on the same page regarding how to treat autism, what autism is, understanding it, so that we can navigate daily life in a smoother manner and have better quality of life. The mission of this app, it's called autismaide, is to reduce the confusion about the symptoms of autism, which can be diverse. It is said that if you know one person on the autism spectrum, you only have known one person. And in my attempt to clarify it, I have the app provide more clearer explanations for sometimes bizarre manifestation that is called autism. So the project aims to create a central location where patients with autism are treated with the goal of improving their symptoms according to the diagnostic criteria for autism, which is the Diagnostic and Statistical Manual DSM-5. The more people use this app, the more data we can have so that we can make an AI, artificial intelligence guided system to be able to know, based on users' experience, a protocol that best match the symptom in the moment, such as difficulty with feeding, with food, being sensitive to different textures. What is the best way to handle it? Difficulty with behaviors and emotional regulation specific to the autism population. What is the best way? Besides looking up Google or even Google Scholars and accessing academic research papers, we also need something which is user-based, experience-based comparison. And I am hoping that this app becomes popular. The more people uses it, the better off we are in terms of providing AI-guided intelligent solutions to the symptoms. And this app is provided at low cost, is unbiased, and a universal tool that allows collaboration with clinicians, teachers, parents, caregivers, the individual, the patient involved, whether they are children or adult, so that we can all work better on the same platform. And I also have a disclaimer. The ideas that is generated is my opinion. It does not represent any discipline. Although I am a board certified behavior analyst, most of my perspective is behaviorally based, not necessarily endorsed by the behavior analytic board. It's my personal opinion. And my intention is to help users better understand, firstly, their symptom, and then be able to have a clear vision of what to do with the symptoms going forward. In order to be diagnosed with autism, and you would have to see a clinical psychologist, sometimes a physician, a psychiatrist, And diagnostic criteria fall under three main categories, which is language deficit, social emotional deficit, and what's called stereotypical behavior. And I will describe each of them. Language deficit can take the form of not being able to communicate at all, not having words, to being rather high functioning, not being able to understand the subtleties involved in speech. There may be a lack of back and forth conversation, social emotional reciprocity, and they may have problems reading body language, holding a conversation, and being interested in other people's interests. So these are general. And of course, I have provided some general intervention ideas, which is commonly used in the field. And since everyone is an individual, after general, we also have custom. So the user, which is either the patient, the caregiver, can put in the challenges that they found relating to language. So they will be able to write it here. The goal is to, of course, improve the symptoms. Percentage before remedy. 0 means not being able to speak. 100, usually I would take it to mean no problem with fluency and reciprocal speech and so on. And then we can also write down what has happened after we have tried certain methods and the percentage improvement. So this is important to write down what the user have done, because then we can tell our AI generated system to be able to compare. Let's say if you try method A versus method B, does it yield better results? So as I've said earlier, this is a user guided ideas. It does not represent clinical intervention per se, although a lot of the ideas are based on the current theories and paradigm relating to treating autism. So, and let me go back to the breakdown of how the app applies. And quality of life tend to be an area that is important for everybody. And you want to be able to know whether the parents' quality of life is adequate or they are struggling. And to make it easier, we have put it in terms of emoji, which actually has percentages behind it so that we can graph it. Quality of life for the child, we may be able to guess by looking at the child. If the child is having a lot of outbursts and crying spell, most likely not feeling too good, that sort of thing. And it can be entered on the calendar and then charted for you. So when the user looks back, they will be able to see whether the quality of life have improved or not, depending on what they do. Let's say they have tried different medication, and we would like to be able to know that it has improved general quality of life. Definition can be up to the user, to the person. Now, another breakdown that the user can select is behavior problem, which commonly happens due to difficulty with speech, with social emotional disconnect, and maybe not having enough repertoire of skills. Behavior, maladaptive behavior can occur. So some of the ideas of how we can handle them generally and specifically, each user can add and put in what they see, and they can talk to the clinician about each particular issue, and the clinician can write back, giving the user some suggestion, and the user then put in percentage after they have tried. Again, ideas will be collected in our AI intelligence system for users to be able to see the effectiveness of one method versus another. Daily living is also an important area. Daily living can include anything from toileting, hygiene, to doing daily tasks, going through life. And this is an area where many people on the spectrum struggles. There are some general things that you can see, and of course, specific things each user can add to their specific challenges. Next, what we want to know is many people on the spectrum do go on medication, and I have supplied some general medication that is typically used for autism, such as risperidone and aripiprazole or Abilify. I have listed some side effects associated with this. So if the uh, the patient is using any particular meds, they can put it in there, they can put in the notes, they can also chart it and note any side effects or any other thing that they may want to communicate with their physician about. So there are some general medications that is commonly used, such as those listed in here. And there are also other kind of drugs, let's say allergy and or constipation, and the user can put in there the name of the medication with some notes, whether or not it has helped or not. This will be tracked in a calendar way to allow us to see whether certain meds have improved. And therefore, it is important to chart not only what happened when the patient takes the meds, but overall effect on quality of life, behavior, daily living. And the last category I would like to go into is the state-of-the-art resources. And these are some of the videos that I have uploaded for use for the general public. And as time goes on, I would analyze peer review research on autism and keep everyone up to date on the latest research development on autism so that it makes this app a one-stop shop for anyone who wants to know what is the state-of-the-art knowledge, research info on autism, allowing us to better understand. And understanding would alleviate our confusion. And in fact, knowledge is power in the sense that we then feel more empowered. And again, the purpose for this app is ultimately provide an AI-enhanced solution and a low-cost solution and a universal tool to allow for collaboration between clinicians, patients, and other parties. When we are all collaborating on the same platform, we will be more effective in alleviating the suffering associated with autism. Finally, autism is treatable, and especially when we are methodical and when we approach each step in a data-driven and peer-reviewed manner, we will reach our destination. What is our destination? The destination is to be able to navigate through and improve upon some symptom deficit, improve quality of life, certainly improve life adjustment so that there is less behavior, to make daily life smoother and transition smoother. And for those who take medication, this is a place for us to put down any side effects and alleviate some anxiety about taking meds. So, and I hold free parent training session twice a month, and anyone who wants to attend my webinar, you are welcome to contact me by emailing me at info at autismparentcare.com. Again, I will type it down for you. It's info@autismparentcare.com. You can also call me. I am based in the USA, international country code 1-317-503-1296 or 1-317-688-1260. This is the first installment of the video instruction, and every other week I will be sending out more video about how to use the app and about the latest and greatest on autism, and have an exciting journey. It is an exciting journey of self-discovery. And I encourage everyone to see the challenges of autism as something that we can learn from, grow with, and even live happily with. Thank you.